Okay, I'm going to perform the suction for Miss Jones' trachs, and I already have the tray with me right now. I'm going to the room. Knock, knock. Hello, Miss Jones. My name is David, and I'm your nurse today. I'm going to perform the suction on your tray. Is everything okay for you? Okay. And I have my mask on, and I have the lab goggles for the inside of the face shield. And I'm going to put my stuff over here, and I'm going to provide privacy. Okay, I'm going to wash my hands first. I'm gonna make sure the trick kit is over there, the emergency kit is over there. I'm going to test the air, and I'm going to turn on the suctions to see if it works. Okay, it's great. And the suction is between 80 and 120. Okay. Miss Jones, first I'm going to pull up your bed. Okay, so we will do that. Okay, sure you're in see my follow position. Okay, then I'm going to wash my hands and open the tray. Pull the gloves out and slowly, sterilely put on my gloves. Okay, the other one. All right, Miss Jones, let me turn on your oxygen a little bit up to hyperoxygenate you to make sure you have enough oxygen during the suction, okay? Turn it on. Okay, then I'm going to put a towel on your chest. All right. Put this away. And I make a box. I put the normal saline into the box as lubricant. And I'm going to slowly take out the suction thing. With my sterile hand, I'm going to wrap it. And I'm going to connect the thing together. Great. And I'm going to take the oxygen off. Unwrap it. With my thumb here, I'm going to tap some lubricant. And I'm going to test the suction.
Thursday we're getting here at like 6:30.
Okay, great. Everything looks good. Then I'm going to put the thing inside until I feel the resistance or the patient cough. All right, patient coughs.
Yeah, I know.
Okay. Then I'm going to put a little bit back, half milliliters back. And I'm going to tap while I'm rotating the tubes out. Great. All right. Then I'm going to put the thing back here. And I'm going to put this, okay. Going to dump this. And I'm going to turn off the suction. I'm going to take off my gloves, and for the oxygen, I'm going to switch it back. Wash my hands, switch the oxygen back to normal. Okay, then I check the patient's status. Ms. Jones, everything okay with you? And check the 4Ps, privacy, pain, and I checked. Oh, let me lower the bed for you, Jones. Okay, I'm going to put all the trash away. I'm going to wash my hands, and I'm going to go to the charting of this. And I finish with my suction. Okay, so after I do for the tracheal suction, I'm going to patient's room to do the dressing change on the patient's tracheostomy. So I'm just going to the patient's room, knock knock. Hi, Miss Jones, my name is David. I'm your nurse today. I'm here to do like a quick dressing change for you about your tracheostomy. Are you feeling any pain right now? No pain? Very good. First, I'm going to set all of my stuffs on the bedside. All the stuff on the bedside. Miss Jones, let me lift your bed up to the certain heights for me. Okay, let me lift the bed up. Then I'm going to turn the head of bed to the 30 degrees to semi-forward position. It's easier for me to do the dressing change. I'm going to put on my gloves. First, I'm going to wash my hands and do privacy, certain stuffs. And I'm going to put on my glove with my dominant hand. Okay, while touching the other sterile part. Okay. All right. Then I'm going to first put this aside. Open the tracheal care tray, and I'm going to put this on the patients, and I'm going to put the shining lining on the patient's body. Okay. So next, I'm going to take all the stuffs out to the clean area, and I'm just going to put the glove here, and I'm going to put all the stuffs in the cleaning side. And then I'm going to take my normal saline bottle and I'm going to use my non-dominant hand to open it and pour some normal saline in the tray. Okay, so the normal saline is in the tray, and I'm going to pre-wet. I'm going to put the tips into the normal saline to pre-wet. I'm going to put the other thing here, yeah, the cleaning stuff here. Yeah, and I am going to put on my other glove. So I should put on my other glove before I touching all the sterile stuffs. Okay, other glove is on. Okay. So let me put this. Okay. So first, I am going to remove the old dressing here. Take this out. Take this out. Okay. And I'm going to dispose it in the trash can. Then I am going to take the inner cannula out and put into the normal saline I just filled. Okay, right here. I'm going to grab the cleaning stuff and I'm going to use this to clean it and wash the inner cannula inside and outside. And I'm going to use this and with the non-dominant hand and pour the normal saline here to flush it and clean it. And I'm going to after cleaning the inner cannula, I'm going to put back to the tracheostomy. Okay, then I dump this. For the tips, I rinse it with the normal saline and wash outwards, inwards to outwards around the tracheostomy site. Okay, I'm going to wash it around, dispose it. Use another tip, wash it around, dispose it. One more time, wash it around, dispose it. Okay, the last one, wash it around, and I dispose it. Okay, then I'm going to take, this is the gauze. I'm taking like the clean gauze to pat it until the stoma near the stoma side is dry. Okay, I'm going to pat it till dry. Okay, I'm going to dispose this. And I am going to apply a new dressing for the tracheostomy. Okay, going to apply a new one on the patients. Yeah. Then I am going to, this is supposed to be a ties around the patient's neck to hold the position of the patient's tracheostomy. So I'm going to untie this and use my tie. So I tied it here and put it around patient's neck. After that, I am going to, everything is done for the dressing change. And I am going to take out of my gloves and I'm going to throw all the things, take the normal saline, throw all the other things away. I'm going to wash my hands, lower the patient's bed, assess the patient, assess the stoma site, assess the tracheostomy one more time, lower the patient's bed until the privacy, give the patient's call light, and I think I'm done with everything.